Hi, everyone. I'm so excited to be here with you. This is probably one of the most fun presentations that I get to do, and is simply because I get to see you shine and make us feel so proud here at the Federal Office of Rural Health Policy. So welcome, everyone. We'll have a presentation of several awards that are nationally recognized in terms of their excellence and contributions for quality improvement. So without further ado, we'll start today. And if I can just advance the slides. I'm having difficulty advancing the slides. Okay, I got it. For today's program, we'll have just a short overview of what these awards are about. Then I will introduce the top 10 performing states, the MBQIP Spirit Award winners, and we're going to have some time to get to know a couple of those awardees as well. And then finally, we'll end with just some closing remarks. So that's the program for today. In terms of the significance of why we're here, so as you know, our program focuses on quality improvement efforts in the 45 states that participate in FLEX. So really, we're here because of all the fabulous work that you all do at the state level to support the critical access hospitals in improving quality of care and patient outcomes. So this work is very important to our office, and we couldn't do a lot of what we do without your support. You're really here to showcase the work that you do, but also to inspire others in your group of state FLEX coordinators in recognizing that quality of care for rural populations is important. And despite all of the challenges, you're all able to find a way to make this happen for those populations. We're recognizing today the efforts in supporting those quality improvement efforts by increasing reporting of the MBQIP measures. So the top 10 awards will actually provide just a glance in all of the fabulous work that is being done around the states that participate in the FLEX program to really bring this, bring to light all of the improvement that has been happening in the past 12 months. So those awards capture the past 12 months of reporting efforts. And then we are also recognizing the MBQIP Spirit awardees who have been nominated by their peers. And they are two fabulous people that demonstrate the MBQIP spirit through the work that they do. So now, you know, I'm going to just call everyone as you will see in the slides. I have put in a little bit introduction so that when we get off this presentation, you can access the slides, print the slides, see them in more detail. But for the sake of time, I'll just call everyone who will be awarded today, who's being recognized, and then you can sort of see more in detail what each of the states do based on what I entered in the slides. So we'll start with the 10, number 10. Utah. We're recognizing Utah for their efforts in the past year. So Michelle T. Chow, big shout out to her for all of the efforts of the Utah Office of Primary Care and Rural Health. Next, number 9 is Illinois. Angie, thank you for all of your efforts this past year. So we're recognizing the Illinois Critical Access Hospital Network. Massachusetts, Ronnie from the Massachusetts Office of Rural Health. Thank you for all of your efforts in the program. Nebraska, Nancy Johansson from Nebraska Department of Health. We're recognizing her and her staff for all of the support that she has provided to making sure that we are able to see and track measures. From Georgia, we have Dawn Number 6, Georgia State Office of Rural Health. They have 31 participating cause, and we thank you for all of your efforts, Dawn. Number 5, Michigan. They have such an innovative program, and we're so excited to have Crystal Barter in the leadership there. Thank you for all your efforts, Crystal. In Idaho, Stephanie Tsai from Idaho Bureau of Rural Health and Primary Care. Again, great work there. Number 3, Wisconsin. Thank you, Catherine Miller, from the Wisconsin Office of Rural Health for all of the work that you have been doing. Number 2, from South Carolina. So Sarah Craig is the state office contact, primarily there at the South Carolina Office of Rural Health. And Britton Herbert is accepting the award today. So thank you for all of your work in supporting the implementation of quality improvement in critical access hospitals in South Carolina. And then finally, our number 1 award goes to Heather Anderson and her team at the Virginia Department of Health, Division of Primary Care and Rural Health. So with this, I'll wrap up the part of the presentation that covers all of the top 10 awardees. It is such an honor to have you all here join us in recognition of these great teams, and understanding that this is definitely a team effort. So, we recognize the leaders today that made this possible, but definitely this award is in recognition of the entire team at the state level. So next we'll have the Spirit Awards, and their commitment to improving quality of care really shined through the nomination. So we're very fortunate to have had an opportunity to just review what others have said about them in the great work that they're doing. And we have 2 individuals that we're recognizing today. They will be, I invited them to do a short speech. So first is Idaho. So Stephanie Tsai from Idaho, Bureau of Rural Health and Primary Care. So she's being doubly recognized for her efforts, and it's so wonderful to have Idaho twice this year. These are some pictures that she shared from Idaho. So lovely family, Stephanie. And then coming up, I asked her to just give us a few words. So if you can just listen.
Hi, everybody. It's Stephanie Tsai from Idaho. I just want to thank the Federal Office of Rural Health Policy for this MBQIP Spirit Award. I am so honored and humbled, and anybody who knows me knows how much I love to fly under the radar. I've been around since MBQIP's inception and have had the privilege of working alongside some incredible people like Mary Sheridan in our office to try and get the CHs on board and to work to keep them engaged. Our KETA staff have been endlessly supportive to make this MBQIP work so much easier now. And, I collaborate quite a bit with Barb DeBon from Cynosure Health. She is an amazingly energetic co-pilot who really works to help these CHs stay engaged through one-on-one quality support calls. Pre-COVID, we were doing in-person events, and I look forward to getting back to that eventually. And then, just trying to get them even on their webcams right now to do webinars to really facilitate that dialogue between these hospitals. I just look forward to being able to do safe site visits again and connect with those QI directors. So anyway, I want to take a minute and really recognize every Flex coordinator out there. You guys are so incredible, and the work that you do really inspires me to do better. I have had the privilege to work with a couple of you guys, and I just appreciate the work that you do every single day. And I think now more than ever is the time to really appreciate those relationships and growing from one another. So I just wanted to say thank you very much. This recognition really does mean a lot. Thank you.
Thank you, Stephanie. That was great. So now we're going to move to the next awardee from Wyoming, Kyle Cameron. Thank you for all of your efforts Kyle had so many pictures that she wanted to share. Is a beautiful state. So I'm very honored to have looked through those, and she's going to just share a few words as well.
Good afternoon, everyone. I want to begin by thanking the person or people who nominated the Wyoming Flex program for the Spirit Award. I want to say that we've been spirited for quite a while, and give a shout out to Michelle Hoffman, who is the state program manager for South Dakota. She worked in my program prior to me coming on board and really built a foundation. I want to thank the state offices of rural health and the National Rural Health Resource Center and Task for the reverse site visit. This is honestly one of those moments when I'm feeling like I really wish we could all be together and want us to be able together. I want to thank the Federal Office of Rural Health Policy and the Health Resources and Services Administration for providing such meaningful work that we are all privileged to do and that benefit the people in our communities. I hear Terry Hill when I say that, and I hear him saying what an amazing job we get to do, and he's absolutely right, we do. When Natalia Vargas called me to tell me the Wyoming Flex program had won the Spirited Award, I wanted to say and did say, well, I guess we need a chair. And after thinking about it for just a little while, I remembered that we have one. Critical access hospitals are centers for health, hope, and support within our communities, and that's our cause.
Thank you, Kyle. So with this, this is a very short presentation to kick off the day. You have a full day of meetings coming up, so I won't keep you long, but I just want to make sure that you really listen to the bits and pieces that makes this presentation so special, which to me is really what everyone else has to bring to the table. And while I was not able to have all of the 10 states provide remarks, I wanted to point out that in talking to each of you over the course of the past few months, I noticed that, there is definitely this sense of inspiration, and each of you do things so differently, but also each of you demonstrate very much at the same level that you have this drive to do the work that we have tasked you with such a passion. And that I guess is what I want to make sure that we leave today with, inspired to bring that passion to the work that we do. That is definitely, as Kyle mentioned, is a privilege to have that passion in the work that we are able to do. And if you feel that way, I can assure you that we can sense that from our end, and it inspires us to do the work as well. So I just want to tell you how important all of this work is, and even though we have ups and downs, we learn from failures for sure. I think in the coming year, I want to definitely see more of this inspiring spirit of MBQIP come through the work that you do for Flex. And with that, I just want to thank you all for all of your support. It's been teamwork to put the slides together, and here I'm sharing another wonderful picture that another of the awardees provided, and it really just shows the passion that you bring to the work. So again, this is what really stands out this program from many other programs, is the passion that you have for the work that you do. So congratulations, everyone, and I hope that you enjoy the rest of the sessions.